Thank you very much, Muhammad Rafiq Tahir Saab. Inshallah, with the help of our worthy speakers, and also we want to have it an interactive workshop, we will be able to achieve the set objectives of this workshop. So we are now moving to the keynote talks. Our first presenter is Professor Junaid Rasheed. He is the professor of pediatric medicine and registrar at the University of Child Health Sciences in Lahore. He will present on infant and child feeding, including adverse and suboptimal feeding practices and potential solutions, as well as the importance of responsive feeding and caregiving. Professor Junaid Saab.
Bismillah ar-Rahman ar-Rahim. Allahumma salli ala Sayyidina Muhammadin wa ala ali Sayyidina Muhammadin. Rabbi shrah li sadri wa yassir li amri wa hlul uqdatam min lisani yafqahu qawli. Very honorable and respected seniors and colleagues sitting around. Assalamu alaikum. You know, the topic which I have been assigned is a little important one. And all of you sitting here must be these experiences which I'll be sharing right now in the next few minutes. We would like to share with each other whatever is being seen in the society regarding the infant and child feeding practices. And we will come up by the end of the conference with solutions that how can we intervene, what are the different proposals to improve our practices of infant and child feeding. My way of doing would be to start with, first of all, the knowledge. What I feel as a pediatrician, I am a teacher, I have taught in undergraduate medical colleges for a while, and then now I'm teaching in postgraduate medical college. This is the place where I work, Children's Hospital, Lahore. And this is our new building of University of Child Health Sciences, and it is under construction. I have no conflict of interest. First of all, a few terminologies for those who know and for those who don't know. When we talk of child feeding practices, the first terminology which is to be known is dietary diversity. How diverse a diet of a child should be. The second most important thing is meal frequency. And the ideal combination of dietary diversity plus meal frequency is known as minimal acceptable diet, MAD. Now you can see the figure. These are the figures from the National Nutritional Survey conducted by Professor Zulfikar Bhutta in 2019, that unfortunately only 14.2% children are taking the right diversity at the right age. And only 18.2 children were taking the right meal frequency at the right age. And if you talk of the combination, that what percentage of children is having the right combination of both, it was hardly 3.6%. We'll talk on this issue later in my coming presentation. Now, what is triple burden of malnutrition? We talk about malnutrition, we forget about obesity. A lot of food practices being carried right now will be leading to obesity. We are already having a higher percentage of obesity in Pakistan as compared to the last 2 decades. Similarly, micronutrient deficiency, the hidden hunger. Many a times a child coming to us, to our clinics, to our place, he's adequate for weight, adequate for height, everything is normal, but the child is having a lot of micronutrient deficiencies. So you see the percentage in Pakistan of micronutrient deficiency or underweight, you can see that wasting and stunting is a big problem. Then you talk of stunting. Stunting means a height for age. That is, a baby is not adequate for that given age, the height is not proper. And the percentage is alarming that it's 40% in Pakistan children. Now you see, if you talk of future, from where you're going to have good athletes, security personnel, and many other, you know that a tall height, produces a better economic results in the society as compared to the shorter height. Similarly, wasting. Wasting means, if I talk in Urdu, kitni haddi pe kitni boti, means at what given height, what weight should be there. So in Pakistan, the wasting percentage is around 23% in children. So these are the figures from the same survey: 40% stunted, 17.7% wasted, 28.9% underweight, and 9.5% overweight. Now the generation we are focusing right now has three problems. If I sit in Lahore, I talk of three problems. Number one is polluted air, number two is processed food, and number three is screen time. So all these three types of problems, we can't help probably the polluted air, but we can help the processed food and the screen time, and the processed food is leading to obesity. Now, if I don't talk of the concept of first 1,000 years of 1,000 days of life, probably the talk will not be able to continue. Now, pregnancy, 270 days in pregnancy, the process starts right there. If a mother comes to know about her pregnancy, and by that time when she comes to know she's already having malnutrition, she's having low vitamin D level, she's having lower MOAC, middle upper arm circumference, the weight is not appropriate, the mother is having a low iron level, by the time she starts or the gynecologist allows her some micronutrients, the baby has developed of a smaller size. So then pregnancy diet is very important. Then we go up to the birth to first 6 months, which is exclusive first breastfeeding. Then 6 to 12 months complementary feeding. And then the family food and micronutrient 12 to 24 months. So this is the main point where we should intervene. We are lacking the concept of communicating our healthcare workers that what is the right time. What we commonly hear, vadda hoke theek ho jayega, eda POVNGC, baad mein ye theek ho jayega, he will grow up and he will be improved. Please try to understand, if you don't intervene at the right time, we are losing our generation. Now, it is a busy slide, but if you just focus for a while, the central point is child weight status. Now, what are the problems which are to be addressed? It's a wide era of problems which need to be addressed. If you go into the first year, a child's individual characteristics, okay, age, yes, gender matters, sedentary behavior, you see, babies are playing on mobile and sitting, youngest baby are having tummies like older people, less physical activity, then familial susceptibility to weight gain, then the way the diet is being given. Now, coming out of the child characteristics, you come to the parenting styles and family characteristics. And you see peer and sibling interaction. Each one of them is playing with a mobile. Family is viewing television. Parents are monitoring or not monitoring the child TV, whatever he's viewing. And parents' own preference, that depends upon their knowledge, parents' activity themselves, they are themselves on mobiles. And this is all going on within our families. Similarly, parents' encouragement of child activity. They are not encouraging child activity because the family pattern, the way of living has changed. Similarly, parent food preferences. People come to us and say, I talked to one family, I said, why don't you eat vegetables? He said, his father does not allow to take or cook vegetables at home. So family preferences are dependent upon the parent food preferences. Similarly, you come on to the outer community, demographic and societal characteristics. Now, socioeconomic status, food security, food, you see, Pakistan is having a big problem regarding food security. Similarly, school physical education programs, then accessibility of convenience of foods in restaurant and home deliveries and things like that. So all this factor is affecting a child's weight, may it be a low weight, may it be a high weight. Then we come on to we have to understand the intergenerational cycle of malnutrition. Unless we understand that inadequate diet will have a low birth, will have a stunted baby, will have a reduced mental capacity, will have a frequent infection, leading to an adolescent who is stunted, leading to a pregnant woman who is having an increased mortality, leading to a low birth weight baby. This is going to cycle needs an intervention at every steps. So as a gynecologist, we have to intervene into the pregnant mother height. The gynecologist says, I have received a poor adolescent. So we have to look into the adolescent. Then adolescent says that we have a poor child growth. So it's like a cycle where different level interventions are required. There are a few more slides regarding this. This is the main challenge which we are having. And so we need a collaboration among all the stakeholders who understand that a low birth weight baby, what is the outcome as far as economics is concerned, as far as child growth is concerned, and as far as our mortality, infections, and statistics are concerned. Now, this is one Scandinavian study, and it was interesting. The findings were good, so therefore I'm quoting here. And I think if you replicate the study in Pakistan, you're going to have similar results. That they talked about insufficient nutritional knowledge among healthcare workers. 25% according to them couldn't identify the patient need of a nutritional therapy. कि किस उम्र पे उसको क्या चाहिए? मेरा ख्याल है, if you talk of Pakistan, if I talk of my own postgraduate residents, probably 70% might not be knowing. 39% lack the techniques of identifying a malnourished child. आपने screen कैसे करना है malnutrition को? 53% couldn't calculate the energy requirement of the right age. किस उम्र पे कितनी खुराक चाहिए? Similarly, national guideline की knowledge, we have a Pakistan Dietary Guidelines 2018, a PDF document, which contains every knowledge which is required for a basic pediatrician, for a basic knowledge of a family physician, how to give food. Similarly, they were not even able to narrate the complications of an insufficient nutrition. अच्छा खाना नहीं खाएगा या अच्छे तरीके से नहीं खाएगा तो उसका क्या नुकसान होगा? I think we need to replicate this study in our healthcare workers, and I am hopeful that the result might be more alarming. This is simply a slide. This was a manual for Pakistan in Government of Punjab, IRM and CS department. They published a Urdu manual for lady health workers, and this was a simple pictorial to be given to the mothers and to see what food should be preferred during pregnancy, giving micronutrients and the food which provides that micronutrients. We can have better pictures for that. Now, for healthcare workers, especially for the doctors, it's very important to understand that if you don't intervene in brain development at the right time, please, we are not going to have the right results. During pregnancy, the human brain is the most rapidly developing organ. Neural tube, 16 days, 4th week, 1,000 cells, 10,000 cells. The picture is showing the data. Then the right nutrients during pregnancy will create the right myelination, the right axons, the right coverings, similarly the right synapses in the baby, and that will go on, and what exactly is required is iron, protein, copper, folate, zinc, iodine, and fats. So we have to master the various food items knowledge which we should communicate as per the social status of the mother to them. We should have, everybody cannot be said कि जाके गोश्त खा लो या जाके फलां खा लो. आजकल तो आप कहते हैं ना दाल रोटी पे गुजारा होता है, तो वो दाल रोटी पे भी नहीं होता. So we have to have food exchange programs, and that manual of national dietary guidelines, it contains a food exchange plan that you can offer to a parent or to a child as per their social economic status. Now, what are the suboptimal dietary practices? If I talk to my crowd, I think it can be listed even beyond it. We start with the poor maternal diet. Obviously, we have a low birth weight baby. Suboptimal breastfeeding. जब बच्चे का सामान थिएटर में मंगवाया जाता है तो दूध का डब्बा बदकिस्मती से साथ होता है. And that's so unfortunate. And by the time the mother is alert, after the cesarean, there is an increased cesarean rate, we have already fed the baby who is having a tummy size of 5 to 10 ml, a 30 ml milk multiple times. And that is how it starts. We are missing that golden drop of colostrum, which the world tells us that is so precious. It's got so much calories and vitamin A and things like that. Similarly, formula feeding has led to too much of bottle feeding. Then, unfortunately, the cost of formula becomes difficult, and by the middle of the first year, the family is bound to shift to cow's milk because they can't afford a formula which was started with a fancy plan right at the beginning. And then in the middle of the feeding plan, when they come to know that formula is very expensive, they shift to the cow's milk, and then the problem starts. Then poor food diversity, meal frequency, and things like that. Now, this is the result of a suboptimal breastfeeding practice. It leads to a formula. It leads to diluted milk, poor weight gain, wasting, poor immunity, and malnutrition. And there are many reasons for that, which I'll be telling later on. This was one data from the same presentation of national guidelines that early initiation of breast milk, like माँ को स्ट्रेट अवे बच्चे को कैंगरू मदर केयर या किसी भी तरीके से माँ से एक्सपोज करना, it is being delayed regularly in Pakistani deliveries. This slide I commonly show. Those people who have heard me before as well, please bear me, that this is the slide I like the most to tell people, this is a human brain. You can see a newborn comes with all neurons which will be required in future life. But they are not having synapses, they are not connected. Now the way the mother connects their brain synapses with a breastfeed, within a month, within 9 months, it is said that at 2 years of age, the connection of synapses is double the adult human brain. And this is so important that if you give mother feed, the polyunsaturated fat in the mother's milk, they are so important to develop this myelination, and that will help the human brain to have a better IQ. So you see, the human brain volume doubles in the first year of age. It will never happen again. The human brain is done by 3 years of age. It will never happen again. So whatever is required in the first 2 to 3 years of life, including the pregnancy. So that is the time the role of pediatrician, gynecologists, and the people who are working on nurturing, it becomes very important. Now the mother milk contains that long-chain polyunsaturated fat which is not available properly in the cow's milk, which is given as a chemical in few of the formulas which are expensive. It is not present in every formula. So how the hell are we going to manage an intelligent child right from the outset if we are not mother feeding? We can have a 5 to 10% extra IQ in a child if you feed the child with the mother's milk. And similarly, gut microbiome. You talk of gut-brain axis, and there are many other people who talk on this. Professor Huma Arshad is a very brilliant speaker. I've learned from her a lot, and she talks very much about gut microbiomes and gut-brain axis and things like this. A mother produces 200 species and genera of bacteria. Biofluid is a dynamic fluid. माँ का दूध एक चलता फिरता एक मुस्तकिल dynamic fluid है. We have to understand कि if in SAM children, alteration of gut microbiomes, अगर एक बच्चा malnourished होगा, they will produce more proteobacteria and decrease bacteroids. If you have an increased proteobacteria and less lactobacillus and bifidobacterium, बच्चे में infection होने से आप रोक ही नहीं सकेंगे. Now this is the problem we are having with bottle feeding. The cycle goes on. If you have a parallel bottle feeding with the mother feed finally waves off because there is no stimulation, there is no production of hormone, and bottle feeding leads to a poor solid intake, micronutrient deficiency, decreased appetite, picky eating, and the process goes on. And Dr. Sahab, mashallah, yesterday I came across a child, 5 साल का बच्चा है, Dr. Sahab 1.5 लीटर दूध पीता है, 2 लीटर दूध पीता है. The calories are being wasted. The child is iron deficient. Now this is the picture of Nelson textbook of pediatrics which I showed to my families at my clinic as well. I've got a display at my clinic, I've got a screen at my clinic, and I reflect these lectures at my clinic. And every family coming to me, they are shown this picture, especially mother feeding. If you just look at the breast milk presentation and the column, and you see the IgM, IgG, IgA especially, lactoferrin, lysozyme, lipases, monoglycerides, all is present in a mother's milk, and you just look at the standard formula, they are lacking it. So you have to create knowledge among the parents. You have to give a mother a passion. एक माँ जो बहुत तकलीफ उठा के दूध पिला रही है, जिसको फैमिली का दबाव है कि डब्बे का दूध पिलाओ, जिसको फैमिली का प्रेशर है कि तुम ये क्या कर रही हो, बच्चे का वजन नहीं फूलेगा, जिसको फैमिली का प्रेशर है कि उसने घर का काम भी करना है, she needs to be told कि अगर आप ये करोगे तो आपका बच्चा ऐसा हो जाएगा. You know what example I give to my families? मैं कहता हूँ जी आपकी गोद में ऐसा क्यों नहीं हो सकता कि ये जो बच्चा इस वक्त लेटा है ये गवर्नमेंट कॉलेज यूनिवर्सिटी का वाइस चांसलर होगा. मैं अपनी माँ की गोद में लेटा था, उसको तो नहीं पता था ये डॉक्टर होगा, ये फलां होगा. हम सब ऐसे ही, हमारी माँओं ने मेहनत करके बाय द बुक पाला, नतीजा अल्लाह ताला ने आपको उसके मुताबिक दिया. तो गो फॉर गुड पैशंस, माँ को उस लेवल पे ले जाएं. और लिटरली माँ वहाँ पे जब उठती है तो उसको एक फील होता है कि मैं प्रॉबली गोद में को बहुत बड़ा CEO को, बहुत बड़ा आर्मी ऑफिसर को, बहुत बड़ा मैं डॉक्टर लेके ये साथ जा रही हूँ. यू गिव द पैशन टू द मदर एंड शी विल बी, उसकी जो बैकेक होती है वो आगे ठीक हो जाती विद द फील कि आई एम डूइंग समथिंग. This is the slide of animal milk. डॉक्टर साहब गाय का दूध ना पिलाते. This knowledge is very important that they don't have anti-infective factors. The cow does not have growth factor. Iron is lacking, vitamin A and C are lacking, fat is not adequate, things like that. Now what are we giving to our children? Poor dietary diversity, low fruit and vegetable intake, जिस दिन घर में कोई कद्दू पक जाए, बच्चे के लिए अंडा पराठा बना दिया जाता है। जिसमें घर में कोई ऐसी वेजिटेबल पक जाए, इसके लिए अंदर से नगेट्स निकाल लीजिए, फलां कर लीजिए, फलां कर लीजिए। योर नेबर कंट्री इज ग्रोइंग ऑन वेजिटेबल्स. Vegetables are so important to keep your gut microbiome normal. So we are giving more sugary drinks, we are giving more junk food, so we are constantly having suboptimal dietary practices. Now, role of iron, we all know, brain development, then neurodevelopment outcomes, things like that. The iron deficiency, these are the figures of iron deficiency in Pakistan. These are the data, the same national nutrition data, starting from 2001 to 2018. If you see, the iron deficiency has increased from 3.6% to 5.7%. When I started my training in pediatrics, there were probably 2 or 3 formula milk in the country. And now you go and look at a departmental store, and there is a line of formula feed lying there, कि जी ये हॉलैंड की भैंस है, ये आपके लाहौर के बच्चे के लिए दूध भेज रही है, ये डेनमार्क की गाय है और ये आपके इस्लामाबाद के बच्चे के लिए दूध भेज रही है. व्हाट द फन. ठीक है जी. सिमिलरली zinc is so important for neurogenesis and migration. Iodine has got a very vital role. Essential fatty acids are so important. Now this is the dietary diversity. These are the pictures of National Nutrition Guidelines of Pakistan. 6 food groups. There are different ways of dividing food groups. कुछ जगहों पे अंडे को एक अलहदा food group भी गिना जाता है. Grains, vegetables, fruits, proteins, dairy, oil and fat. Now these are the 6 food groups. This is known as dietary diversity. And how to produce a dietary diversity? You have to make multi-mixes. आप चीज़ों को जोड़ के बनाते हैं. हम एक चावल पका के भी से कि जी आज हमने we have a rice with pea. If you go to any Chinese chawal, there are at least 4 vegetables, their meat, their egg, the oil and things like that. Why can't we have multi-mixes at our home? Now this is the food pyramid. If you see, you need maximum calories from grains followed by vegetables. Number 3 is fruits. 65% of calories are circulating around grains, fruits and vegetables. And then you come on to protein, animal and plant protein, and last is milk and milk-based items. And while in our country, more of bottle feeding has led to almost 60 to 70% of bottle feeding is leading to milk intake. We have to put it down. Similarly, now if you look at this even food plate, if you talk of vegetable, डॉक्टर साहब आलू खिला देती हूँ. If you talk of fruit, डॉक्टर साहब केला खिला देती हूँ. That's it. Potato is not a vegetable, it's a carb. People don't put it into a vegetable, they put it into grain because it's providing carbohydrates. Now what is responsive caregiving? We are lucky to have families. एक एक घर में बहुत से बड़े छोटे, they are playing with their kids, they are ये फला खाना मुझसे मांग रहा है, 6 महीने के बच्चे को दादी anticipate कर रही हो, he's asking for this thing. We are lucky to have it, but this sir said that we need to train them at the right path. So responsive caregiving is ability of a caregiver to notice, understand and respond to the child's signals. If you don't do it, you miss. You know, Dr. Sahab, ye rota bahut hai. Crying is the last call of help. Before that, the child is fisting, the child is flexing, you are not picking it up. When the child makes a scream, जब बाजा बोल जाता है तो पता चलता है कि बच्चा तकलीफ में है. If before that there are many cues which you learn gradually, and you have got to teach your parents how to pick it up. Similarly, verbal and non-verbal gestures of the baby. Responsive caregiving is so important. अगर आप बच्चे के साथ सब मिलकर बैठ के खाएंगे तो जो चीज़ वो महसूस करेगा वो अकेले बादशाह सलामत के सामने एक प्लेट रख देने से मसला हल नहीं होगा. You see, then screen dependency. This is what we start. 4-4, 6-6 महीने का बच्चा एक चीख निकालता है आपके क्लिनिक में, मोबाइल बाहर आता है उसके सामने रख दिया जाता है. We have to communicate that. That is leading to more problems with behavioral disorders, aggression and things like that. Now, what is the right time? Please tell them it is proved by evidence. 6 महीने से साल के दरमियान इंटरफेयर नहीं करोगे ना खुराक के मुतालिक. It's not about giving food. It's establishing complementary feeding. उसको सिखाना है, बहुत कुछ शामिल है. Increase exposure to new food. अगर आप नहीं करेंगे, बच्चा एक खुराक नहीं लेता. डॉक्टर साहब, he's not accepting it. What to do? Change the presentation. हम KFC के बर्गर में बंद गोभी का पत्ता खा जाते हैं, घर में नहीं खाया जाता. You change the presentation. Change the environment. People are sitting together and eating. Change the room. एक कमरे में खिलाओ, अगली बार दूसरे कमरे में खिलाओ, अगली बार तीसरे कमरे में. You'll find a change. चेंज द पर्सन. बच्चा माँ से तंग आया होता कई दफ़ा कि माँ उसको नहला भी रही है, धुला भी रही है, सर्वेलेंस भी कर रही है और हर बात पे मना भी कर रही है. समटाइम्स अ aunt can do it, sometimes a nano can do it, a dado can do it. They just divide and do things like that. और एक दफ़ा बच्चे ने इनकार किया, you stop it. That's not the way. You should give 8 to 10 exposures before you declare it's not working. Similarly, infants in child eating behaviors. डॉक्टर साहब ये चीज़ उसने नहीं खाई, मैंने नहीं दी. You see, what I teach my अगर कोई बच्चा मेरे पास आता है 8 साल का, डॉक्टर साहब ये सब्जी खाता ही नहीं, आप इसको समझा दीजिए. You have to tell them कि बेटे जो चीज़ ज़रूरी है. लेट्स से आप स्कूल जाते हैं, आपको साइंस पसंद नहीं तो आप लेक्चर में बाहर नहीं आ जाते. आपको पढ़ना वो भी पड़ता है और आपको नंबर उसमें भी लेने पड़ते हैं, चाहे ज़बरदस्ती पढ़ना पड़े. जो चीज़ आपके लिए अच्छी वो आपको खानी पड़ेगी. No salt, no sugar below 1 year of age. You all know that infant's kidney cannot cope with salt high intake, and too much of sweet causes a lot of problems and increased glucose level. आपने 2 गुलाब जामुन खा ली, आप खाना नहीं खा पाते. If you give too much of sugar, बच्चा जो है वो उतनी अच्छी कॉम्प्लीमेंट्री, तो जो नेचुरल टेस्ट है किसी डाइट के वो उनको दीजिए. Even if a mother in pregnancy takes a diverse diet, this is an evidence, the amniotic fluid, even breast milk, pre and postnatal gives a flavor stimulation. जब आप बच्चे को एक माँ जिसने वैरायटी खाई हो हमल में और दूध पिलाते वक्त वो वैरायटी खाए, उसके बच्चों को उन जायकों की सेंसिटाइजेशन होगी. जब फर्स्ट टाइम आप कॉम्प्लीमेंट्री फीडिंग में वो जायका लेके आते हैं तो जिससे हम कहते हैं ना कि आपको शायद पहले भी कहीं देखा है, तो उस बच्चे को लगता है कि ये जायका मैंने कहीं ना कहीं, ये फ्लेवर, ये ऑरा मैंने कहीं ना कहीं सेंस किया है. तो जितना माँ डाइवर्सिटी खाएगी हमल में और दूध पिलाने में, उसका नतीजा होगा. फन इन द किचन. आप एकदम खाना बना के ले आते हैं बच्चे को. अगर अपना बच्चा 2 साल की उम्र में जाके अपनी पसंद की चॉकलेट को इशारा कर सकता मुझे ले दीजिए, तो आप उसको सब्जी खरीदने साथ ले जाइए. मेक हिम फील कि ये घिया क्या होता है, ये टींडा क्या होता है, ये दाल हाथ में कैसी लगती है. लेट हिम डू सिट विद यू इन द किचन. आप मटर छील रहे हैं, आई यूज टू सिट विद माई मदर. आप चावल जिसको कहते हैं चुन रहे हैं, वट एवर यू आर डूइंग, जो चीज़ सेफ है बच्चे को किचन में शामिल कीजिए ताकि वो सारे ऑरा, स्मेल, फ्लेवर, फील, ही विल एक्सेप्ट इट. ठीक है जी. देन फस इन द प्लेट. ये बादशाह सलामत को चमचे में डाल डाल के मत दीजिए, उसके सामने रखिए. लेट हिम बी. दिस इज रिस्पॉन्सिव केयर गिविंग कि बच्चे को. एंड आई फील जो फिंगर फूड है दैट इज बेटर देन अ प्यूरी फूड. ये जो आप मलीदा सा बना के 2-2, 4-4 साल तक पिलाते रहते हैं, खिलाते रहते हैं, बाद में इट्स सो डिफिकल्ट टू शिफ्ट ऑन अ सॉलिड फूड. इट्स वाइज टू स्टार्ट अ फिंगर फूड प्रोसेस अर्ली. मेरे पास बच्चे आते हैं जिनकी 10 साल पे माँ कहती है डॉक्टर साहब गोली खा लेगा, नो इशू. गोली करा भी देता है, गोली खा भी लेता है. और मेरे पास 26 साल की एक बच्ची आती है जिसकी माँ अभी भी पीस के गोली देती, ना आदत डाली. जब हर स्टेज पे शी विल वॉमिट, शी विल वॉमिट, शी विल, एंड द प्रोसेस गोज ऑन. सो रेसिप्रोकल रिलेशन, इन्फेंट्स hunger cues, parents interpretation, infants response, infants signal, parents, and ये सब चीज़ें एक साइकिल में घूमती हैं जिनको सिखाने की ज़रूरत है. और सबसे पहले हेल्थ केयर वर्कर को सिखाने की ज़रूरत है. माँ बाप तो बहुत दूर की बात है, हम जितने पीडियाट्रिशियंस प्रोड्यूस कर रहे हैं उनके पास ये मालूमात नहीं है. दिस इज द WHO रिकमेंडेशन ऑफ अर्ली चाइल्डहुड डेवलपमेंट. रिस्पॉन्सिव केयर गिविंग, promote early learning, integrate caregiving and nutrition interventions, support maternal mental health. Yes, when I counsel the mother for breastfeeding, I look at the father कि देखो बेटे तुम्हें खाना ठंडा भी मिल सकता है, शायद टाइम पे तुम्हें हमेशा कपड़े इस्त्री ना मिले. एक लड़की दूध पिलाने में 2 साल में 8,500 से 9,000 दफ़ा बच्चे को अपने साथ लगाएगी. दिस इज नॉट अ सिंपल बिजनेस. 9 महीने का हमल, 24 महीने का दूध, 33 महीने एक लड़की एक काम में दौड़ेगी एक बच्चे के लिए, 66 महीने 2 बच्चों के लिए, 99 महीने 3 बच्चों के लिए. मीन्स पहले 10 साल में 8.5 साल या लड़की हामिला होगी या वो दूध पिला रही होगी, या वो हमल में होगी या वो दूध पिला रही होगी. इफ़ यू वॉन्ट टू कॉन्ट्रीब्यूट टू योर बिजनेस ऑफ योर जनरेशन, ये तुम दोनों की नस्ल है, माँ के 3 दर्जे हैं, बाप की 4थी बारी है, तो तुम्हारी कॉन्ट्रीब्यूशन ये है कि सपोर्ट है. And if you support as a family, so then things go up. So to eat is a necessity, but to eat intelligently is an art. Thank you very much for your patient listening.